Did you know that over 1 billion people worldwide might be deficient in vitamin D? For decades, vitamin D was only linked to bone weakness or rickets, something we thought was left behind in the industrial age. But rickets is just the extreme version of deficiency. In reality, millions of people today suffer from mild, unnoticed vitamin D deficiency, and that can silently affect your mood, your energy, your immune system, and even your weight. So in today's video, we're going to explore 10 hidden signs that you might be low in vitamin D and how to fix it naturally. If you care about your long-term health, grab a seat, hit like, and let's dive in. If you seem to catch every cold, flu, or infection going around, it could be your body's way of saying it needs more vitamin D. Vitamin D plays a critical role in your immune system, acting like a shield that protects you from viruses and bacteria. Studies have shown that people with low vitamin D levels get respiratory infections more frequently, including colds, bronchitis, and pneumonia. In fact, in one study, participants who took 4,000 IU of vitamin D daily had significantly fewer infections and stronger immunity overall. Feeling tired all the time? Struggling to get out of bed, climb stairs, or stay awake during the day? Low vitamin D might be to blame. It's often mistaken for stress or poor sleep, but research shows that people with low vitamin D experience persistent fatigue and muscle weakness even when they rest. A study on nurses working night shifts with little sunlight exposure found that nearly 90% were vitamin D deficient and felt chronically exhausted. After supplementation, their energy levels improved dramatically. This one's personal for many people. If you suffer from chronic lower back pain or joint stiffness, vitamin D deficiency might be contributing. Research shows that people with lower vitamin D levels tend to report more intense pain. A review of 81 studies found that individuals suffering from arthritis or chronic pain had, on average, lower vitamin D than those without. It's not a cure-all, but improving your vitamin D status may reduce pain and improve mobility. Several studies have found that people with depression often have lower levels of vitamin D. While not all research agrees, some trials show no effect, experts believe that the duration and dosage of supplements in those studies were too low. Other trials found that supplementing with vitamin D can significantly reduce depressive symptoms, especially in seasonal depression during winter months when sunlight exposure drops. So if your mood dips every winter, your vitamin D might be part of the reason. If your cuts or surgical wounds take a long time to heal, you might be low in vitamin D. This vitamin is essential for collagen production and tissue repair. A meta-analysis found that people low in vitamin D healed much slower after dental surgery and had higher rates of infection. In diabetics, vitamin D deficiency is linked to foot ulcers that are hard to treat. One small study found that after just 12 weeks of vitamin D supplementation, wound healing speed improved dramatically. This is one of the classic signs. Vitamin D is essential for calcium absorption and bone mineralization. Low vitamin D levels lead to bone softening, osteomalacia, and can increase the risk of osteoporosis, especially in women after menopause. One large study on over 1,000 women found that those with the lowest vitamin D levels had significantly lower bone density. Even if supplementation results are mixed, combining vitamin D with vitamin K2 and proper diet gives the best results. Unexpected or patchy hair loss, like alopecia areata, can be related to vitamin D deficiency. Vitamin D plays a role in hair follicle growth, and severe deficiency can trigger autoimmune-related hair loss. In one study, people with alopecia had much lower vitamin D levels, while others who took supplements for 12 weeks saw reduced hair shedding and faster regrowth. Muscle pain isn't just from workouts or tension. It could be a lack of vitamin D. Your body has vitamin D receptors even in pain-sensing nerves. Deficiency can make those nerves more sensitive, amplifying discomfort. Studies show that supplementing with vitamin D can reduce generalized muscle pain even in children. One study reported a 57% drop in pain intensity after a single dose. Low vitamin D and excess weight often go hand in hand. Fat tissue tends to trap vitamin D, making it less available for your body to use. Studies also suggest that low vitamin D might influence fat storage and metabolism, especially in the abdominal area. Combined with low magnesium, which works with vitamin D to regulate blood pressure and energy, the effect becomes stronger. If you're gaining belly fat despite eating well, your vitamin D might be part of the story. Finally, anxiety. Low vitamin D is increasingly linked to mood disorders, not just depression, but also anxiety and irritability. One study found that pregnant women low in vitamin D were far more likely to experience anxiety and postpartum depression. When they received supplements during pregnancy, their symptoms decreased significantly. So, as you can see, vitamin D is more than just a vitamin. It acts like a hormone, influencing nearly every system in your body. It helps prevent bone loss, supports your heart, boosts immunity, balances mood, and even protects against chronic diseases. If you think you might be deficient, talk to your doctor and get a blood test, especially during winter months. Before jumping to supplements, try increasing your natural exposure to sunlight. Even 30 minutes to 1 hour a day can make a big difference. You can also get vitamin D from fatty fish, egg yolks, or sun-dried mushrooms, and if needed, consider a supplement that combines vitamin D3 and K2 for optimal absorption. Want to learn more about the best ways to raise your vitamin D naturally? Check out this next video right here. If you enjoyed this video, give it a thumbs up, subscribe, and hit the bell icon. Because every week here on the Vital Nourish, we bring you science-backed ways to stay healthy, live longer, and feel your best. See you in the next one. And remember, stay nourished, stay vital.